Hello, good afternoon, everyone. Can you hear me? I believe all the sound and are good, and all the participants actually have been muted to give way to the speakers later. Okay, a very good afternoon to everyone and selamat tengah hari. On behalf of Persatuan Pegawai Sains Malaysia, PPSM, a very warm welcome to all of you for joining us today. This is the 12th webinar that we have organized under PPSM this year. For your information, I'm Sally, the moderator for today's session. Our session today is titled Current Trend in Parasitic Infections in Malaysia, and it will be running from 12 noon to 1 p.m. with a duration of 1 hour. With here today, we are honored to have with us our distinguished speakers, Associate Professor Dr. Malina Osman. Let me introduce her in details before we start this session. She is an Associate Professor in Department of Community Health, Faculty of Medicine and Health Sciences in Universiti Putra, Malaysia. She was born and brought up in Johor Bahru, later continuing her studies in Universiti Kebangsaan Malaysia for her both undergraduate and postgraduate levels. She is a public health specialist with subspecialty in epidemiology and biostatistics by training. She was formerly a medical officer and an assistant director in Communicable Disease Division in the Ministry of Health, Malaysia. Her research is mainly on tropical health, molecular epidemiology of non-infectious diseases, and social behavioral studies. Besides formal academic activities, she has also actively involved as a health volunteer in providing care and support to selected refugee groups in Malaysia through various organizations. She is also known actively contributing various information and health advocacy through various media. Without further ado, let's welcome Dr. Malina to begin the session. Dr. Malina, over to you.
All right. Thank you very much, Ms. Sally. I am already sharing my slides. You all can see my slide? Can you all see my slide?
Yes, from my end, we can see.
All right. Okay, thank you very much. First of all, I would like to thank the organizing committee of inviting me to share some of thoughts during this special session, your webinar series. I think I've shared once upon a time, I think 2 or 3 years ago during our post-pandemic time. But for today, I was given a task to share on current trend of parasitic infections. But then I have told Miss Sally that day, because of scope of parasites so wide, I have zoomed into only one portion of the parasitic infection, so that our discussion about, I think, 40 minutes or 45 minutes from now, and we are going to have some Q&A session afterwards, or perhaps you want to share some of your experience in the field. I would provide some of the insight related to intestinal protozoa, or the luminal protozoa, which includes both the intestinal and non-intestinal. Means that the parasites that inhibits in a lumen. In general, as you all aware, parasites in general can be divided into 2 or 3, but based on its morphology, I just divide it into 2, whether it is unicellular or multicellular. I have presented on multicellular, I think a year ago, during webinar with Ministry of Health. So that today I'm going to share further some of the topics which I think are quite important, particularly when we talk about the parasites. And I just want to share my insight. Relatively, parasitic infection was not being given, not to say full consideration, but then basically based on our current trend of all those infectious diseases, relatively parasitic infection is not that common as, like bacteria or virus, but then it should not be overlooked in order for us to provide best treatment for our patients as well as the community. And most of the parasitic infection, if you realize, very much related to some of the component in community health, meaning that it is not enough for us to provide some of the treatment in the hospitals or clinics, but then need to be accompanied with some of the intervention at the community. So this is the list of the one that I have selected, but then the list for the important medical protozoa is very long, but then to cover during 1 hour, I think it will not be enough for us to discuss in detail. And then based on my experience, usually when we talk about the parasites, it become, when at the middle, it become very, very boring, and then kita lost. We are talking about which organism. So that I zoom into the one that I have mentioned at the earlier of my presentation. I'm going to explain on the luminal, which covered both intestinal and urogenital. And at our academic, practice, usually I would emphasize only 3, but then the rest also important, What are the 3? The EH, Entamoeba histolytica, and then we have Giardia lamblia, and then we have Trichomonas vaginalis. While for the tissue protozoa, I would highlight one of it because I'm also will be sharing, some thought on the opportunistic infection, which relates to medical important protozoa. While for the rest, and we know that it is will not be adequate if we left, topic on malaria, and we know that malaria is very important in our country, but I will not include this because discussion on malaria relatively quite long, and then it will, focus on the other side, as the mode of transmission totally different compared to the luminal protozoa. But I'm going to cover the Toxoplasma gondii because the mode of transmission also almost the same, like the main luminal protozoa. And then it links with the immunocompromised groups, or what we call as the infection of parasite that occur in that group that identified as opportunistic infection. So basically, this is the long list. I think not the longest, and there are some other of those parasites. But the one that I listed here, which included in our curriculum that we covered here for just for information for our undergraduates, but some of it we highlight during their postgraduate trainings as well as at masters and PhD. So some others that are important include Azospora belli, Macrosporidium, Sporidium parvum, Blastocysts, and so forth. Just that Pneumocystis gyrovesi, or formerly known as Pneumocystis carinii, I think during my undergraduate student, it was classified as fungus, and then it reclassified as parasite, and then it interchangeably from years to years. But then for the sake of discussion, I just include here, even though some of the parasitologists, they do not like this one to be included under parasites, but just for the discussion, I just put it as it is one of important the causative agent for the opportunistic infection. I think before I proceed further, I would like to just to welcome, if you have any question, Miss Ellie perhaps can help me. If you have any question, you can just stop my presentation, because relatively I will not aware what happened on the ground. This is very much different.
Yes. Excuse me, Prof.
delivering,
May I need your attention? I think you need to start your video again, because just now your screen was
see.
frozen. Yeah.
Frozen, I see. Okay. Or
Let's
else I
try.
just mute it first throughout. Is it okay? Because
No,
I
the
think
voice is okay.
my internet not that good,
I see.
Or just or else I just I restart it.
Just try to re-click on the video.
Yeah, I know.
Yeah, it's better. Right.
It's okay. All right.
Got it. Okay.
Our
You may continue.
internet today not that good, so I would
I
like to
see.
apologize for that. I thought that I want to use my laptop, but then some of the also not that welcoming, the line. So I just
I
use
see.
whatever I can.
All
But
right.
I hope that you
It's
all
doing
can be
good now.
patient.
Yes.
Correct. Okay, so I can continue, the presentation.
Yeah. Whoever would like to interrupt for the question, you may raise up your hand. I can unmute you to ask the question directly in the middle of the talk. Yeah. Or else you can just type your question in the chat box.
Yeah.
And I'll read out through at the end of the session later. Okay.
All right.
Please
okay,
continue.
thank you, Miss Ellie.
Welcome.
So that basically these are all the lists, plus 3, the main one that I have mentioned, plus Toxoplasma. The one that I'm going to present for the trend is only those 3 plus 1. Means that for the entamoeba, Giardia, Trichomonas, and Toxoplasma. The rest I will put it, together. We have no specific study for the opportunistic infection, which have that been done widely in our country. But then I'm going to share some of thought related to that. Yeah. All right. So luminal protozoa is actually include the Trichomonas vaginalis as well. Yeah, usually when we talk about the luminal protozoa, we will, pointing towards the intestinal protozoa. But then from parasitology point of view, usually we put it together because they are inhabiting in the lumen. So I start my presentation, just to share some of our experience earlier. I think in 2014, this one, or 2011. This was in just I name it, because this is for academic exercise, not to put whatever ni you all complain lah confidential. No, this is dulu pernah berlaku lah, in one our main hospitals, in federal territories, a patient presented with rectal bleeding, so she was in shock. You tahu kan, shock means that dia dalam keadaan yang emergency lah, dia punya cardiac output tu tak cukup, is inadequate to fulfill the tissue perfusion, and then she was very in a critical ill and had to be resuscitated. And then the laparotomy, emergency was conducted, where it was found that cecum thickened, and then they've done the hemicolectomy. Hemicolectomy means that part of the colon has been removed, as if, because the main provisional diagnosis during that time was cecal tumor. And then it has shown that the cecum thickened, covered with some of the fibrinopurulent exudate. And then the section, mimic as if it is a cancer or carcinoma or tumor, and we do not know until the histopathological examination that will be done during that time. But surprisingly, we did find some other thing. This is the findings on the HPE, and I just want to share with you. Patient usually when they presented with rectal bleeding, there are some other differential diagnoses, and with our situation in Malaysia where cancer or tumor, being given more attention, those came with rectal bleeding. Sometimes this will be looked much more in the prioritized measures rather than some of the parasitic infection. So during that time, they say that most likely tumor, and then the differential may be hemorrhoids, and lower in the list will be all those parasitic, the potential parasitic infections. The one that I have showed you here is actually what the EH, actually, the entamoeba histolytica, which was found microscopically, so that the sections, full with some of those intermingle with inflammatory. The one that I've just screenshot is very simple, just to point to the entamoeba histolytica. And then it has been confirmed. I can't remember during that time whether we did the PCR or not, and the case has been documented in one of our case report in one of the journals. So this is the one that I would like to share with you. So this is the real case where EH, is actually one of the important parasitic infection, but then because of burden of the disease in Malaysia doesn't pointing, to this infection, but then some of thought, you should be there when we have patient presented with rectal bleeding. So she was given treatment and show uneventful outcomes. But then the one that we miss, not to say mistreating this patient, but then the part of the colon have been removed. The hemicolectomy, it is actually can be prevented if the diagnosis is being done earlier. Okay, so entamoeba histolytica, this is from the theoretical point of view. It can be both, in the form of trophozoite and cyst, and we know that the infectious stage in the form of cyst. I won't, go deeper into all those the biological properties, but just to highlight part of all those related important information. The life cycle will involve both the trophozoite cysts. When the environment, is not favorable, it will change into cysts. If it's favorable, then it change, transform into trophozoites. And mode of transmission, formerly, originally it has been known, to be transmitted through food and waterborne. But then because of the change in lifestyle, it has been found among those who practice carnal intercourse, men sex with men, and some of those who have some high risk sexual behavior. Main presentation of the intermediate histolytica is parietal bleeding. Parietal bleeding. So that if patient presented more likely towards the infection, one of the causative agents that we may think would be the intermediate histolytica. Apart from intermediate histolytica, what you can think would be another protozoa which I did not include in my presentation would be the Balantidium coli. And for the intestinal helminths, like Trichuris trichiura, cacing rambu, juga can present with intermediate histolytica. There are all those differential from parasites, but then it also can give me 2 minutes. I have important SMS to WhatsApp to reply.
Okay.
Okay, so what do we have is that it also presented with some of other clinically, at other tissues, but most of it will present in the intestines, whether like diarrhea, flatulence, cramping, and it also can be presented eyes, and then liver as well, and one of the important complications, what amoebic liver abscess, one of the important liver abscess in the surgical discipline. This is the trend, in Malaysia. When I search, for all those things, I have never done study on intestinal protozoa, because I found that in the laboratory, particularly, the trophozoa is very sensitive. It is unlike when we do study on intestinal helminths, but then the cyst, will be persist. But not many study on the intestinal protozoa like EH, and apart from it, we know that there are some other entamoeba like entamoeba dispar, or this one Moshkov's key, something. The other species of entamoeba that mimic, the morphology of the EH. During the time when we don't have the PCR, some of those diagnosis may be overly, diagnosed. They are not EH, but perhaps E. dispar or E. Moshkovsky. But then with the presence of PCR, it has changed, some of those trend in terms of the distribution. It has been reported that the range, 1 to 47, but then the one that I think that would be reliable when you put together the diagnosis in terms of how to confirm, it should be accompanied with PCR as well. It is not enough if we look under the microscope, because some of other bias, when we put some of the conclusion. So I just quote one of the studies, Saidin et al. In 2022. This is on the latest, where they provide some of the information related to the factors, the risk. But then I just would like to highlight here, from public health point of view, or from the medical point of view, when we are going to solve the issues, the one that we need to confirm would be the infection that have some clinical link, I mean, only that have clinical significance that need to be highlighted. No need for us to provide some of the factors towards like E. dispar, because E. dispar have no pathogenic manifestation enough for us to just zoom into E. histolotica. That would be my comment, because in this paper, the authors, have included some of the risk factors for the E. dispar. Yeah, I think, or E. moschkowski. From public health point of view, it will not, something that meaningful to help to solve the issues. In fact, it raise some of the burdens. We interpret something which is not relevant. Yeah. All right, and then next I move to Giardia lamblia. Giardia lamblia similar like Entamoeba histolytica, but then for Entamoeba histolytica, it is pathologically it is quite invasive. But Giardia lamblia, the progress, in the pathology, its cause, relatively much benign, where the parasite usually just adhere to the the lumen of the small intestine, and the symptoms very much less, remarkable. If in EH they have the per-rectal bleeding, but then in Giardia lamblia they just have what they call the diarrhea, false smelling diarrhea, where it has high fat content, in the fecal materials. So in terms of transmission, similar like EH. It is transmitted via food and waterborne, as well as some of the high-risk sexual behavior, and it also present in both form, cysts and trophozoites. Okay, this is the clinical manifestation that I have mentioned. It has some, malabsorption syndrome, together with diarrhea, false smelling, as well as the abdominal discomfort and flatulence. And it also associated with decrease in vitamin B12. These are all those reported human giardiasis, throughout. The one that I paste here only from 2015 to 2020. The last, I think, the latest one, the one that I put findings by Saidin et al. On Entamoeba histolytica, but then the giardiasis, I just only up to 2020, the latest one. So basically, if you look here, they have a very different target population, poor indigenous school children, migrant workers, and some of those who they think that from the high risk groups, and numbers, of the samples also different, they have a few hundred, and then I think the largest will be 611. 611. So basically the trend, very wide, right from sorry, this one 0.3, 0.3 up to 1534, 34.6. From epidemiology point of view, we cannot comment much, because the sample they have in a very specific community background, so that we cannot infer to our general population. So that's why it's very difficult to interpret the trend, from epidemiology point of view, because by right it should be done like what we did for obesity, diabetes, where they have a sample throughout our country, appropriate sampling, and then usually they have almost similar, the background of the respondent. But here they are very much different, so that it's difficult for us to comment. And in my opinion, all those intervention at the community level should go into the specific background of the community. While at the clinical side, when we diagnose, then we have to treat appropriately. Next, we move to Trichomonas vaginalis. Trichomonas vaginalis very simple, the parasites, very simple, but it is only transmitted through sexual or associated with poor toilet hygiene, and it only appear in a form of trophozoite. It has no cystic form. It has no cystic form. And then basically the presentation, inflammation, at the reproductive system, as well as perhaps they have some of those urinary symptoms, but then not that remarkable compared to UTI, whatever. So that this one, Trichomonas vaginalis, we group together with luminal being discussed. And one of the important aspects of this Trichomonas vaginalis would be the treatment, similar like EH and Giardia lamblia, using metronidazole. Trichomoniasis, I only found this one, only one study being done in our country, by Amal et al. It is quite long ago, about 15 years ago, and the prevalence is very low, 0.36%. Means that if we put into perspective per million, it's about it's very low, very low compared to other parasitic infection. This is the overall risk factors for the luminal protozoa, which I put it together. By right, I have to segregate, between the intestinal and the one like Trichomonas vaginalis. But basically, in general, risk factors, for the transmission of this luminal protozoa related to the poor hygiene, hand, food, as well as toilet hygiene, and also related to the high-risk sexual behavior. And on top of that, it also related to some of those immunocompetency of the individuals, and it has been associated as well with the travelers, and then those who are exposed, with the area with poor clean water, particularly for the drinking water, and then this is the one that I mentioned, the treatment for EH or Entamoeba histolytica, the Giardia, as well as for the Trichomonas. We have only, not only, they have a similar drug of choice, which is metronidazole. But then, for your information, if you look deeper for each of the parasite, they have their own first line, second line, and when it that doesn't respond or involve other tissues, they have to add some of others antiparasitic. But for the first line treatment, usually they will opt for metronidazole. Metronidazole also being used, clinically for the anaerobe bacteria. And in terms of prevention, it is not only, when we talk about the prevention, it should be something which is really strategized according to the background of the community, as well as their culture, their lifestyle, as well as to deliver the knowledge so that it can enhance their understanding, as well as to empower them to prevent they themselves from being infected. But in terms of severity, if compared to some other, it depends on patients' general well-being. I'm going to explain as well in the opportunistic infection later on, where the presence of this infection usually clustered together with some of other medical illnesses. Okay, now we move to Toxoplasma gondii. Toxoplasma gondii, different group, if you remember, when I mentioned Toxoplasma gondii, it is a tissue protozoa, one of the important tissue protozoa, but then because it links with the mode of transmission, similar like the intestinal protozoa, as well as the presence, its role in the opportunistic infection, so that we have to include it as well in our discussion today. Special with Toxoplasma gondii, it is linked with the cats. I know that most of us like cats. I myself cat lovers. But then we should make sure that when we deal with cats, some of those hygienic approach, to be implemented, and it is advisable, those who are pregnant, to avoid contact with any stray cat. If you love cat, then you have to reserve yourself until you successful deliver your baby later on, because it is linked with the congenital toxoplasmosis. And in general, toxoplasmosis or infection by Toxoplasma gondii very complicated because it has many infective stages. Because our sharing today is more on to see the trend, so that I'm not going into the parasitic of those details. But then in general, the stage for the infective stage for the Toxoplasma gondii, we have bradyzoids, we have tachyzoids, and we have oocysts, and all those infective stages, they present in a various form of environment. I give example like oocysts, it present in environment. Sometimes, when someone, contaminate their hands, with the soil, which, together with the cat fecal materials, they can have all those oocysts, that been transmitted to their food. And if they are working in the laboratory, tachyzoids are very important. And I myself, based on our experience, do some of those work on toxoplasma. I would advise if they get pregnant, please do not enter the laboratory. And then we have another one, bradyzoids, where it presents in a dormant form in a tissue. This is what they link sometimes, like what we have, if meat is not properly cooked, then, they provide, some of the potential infection that may occur. Yeah. So basically, this is not that as simple as what I showed you here, but then just that to link, how Toxoplasma gondii, can infect the person. Basically, it is very important for those who are, this is the one that I mentioned to you earlier, the oocysts, bradyzoids, and tachyzoids. It depends on the immunocompetency of the individuals, and it is very important, particularly when it occur in immunocompromised, because basically for those who are immunocompetent, it has no issues. A patient usually will be recovered uneventfully. But then if person, immunocompromised, infected with Toxoplasma gondii, they may die because the infection is very severe, where it will provide some of those very severe the manifestation of the clinical symptoms, signs, as well as signs. Yeah. Another clinical manifestation that would be very important would be the congenital toxoplasmosis. This is affect those who are pregnant. They will not affect the mother, but then the future baby, when the infection occur, particularly in the first trimester, it can affect, the baby, where some of the complications include preterm, and the one that being associated usually the hydrocephalus, the intracranial calcifications, the one that's, in a very severe form of calcification. And of course, toxoplasmosis is one of the disease torches, if you can remember, about the congenital infection that we have learned before. It is not only toxoplasma, but also some of those other infection that can occur from bacterial causes. Yeah. So how to diagnose? And I found it very interesting. For the protozoa, medical important protozoa, one of the common being studied is toxoplasma. Why? Because I think because of the mode of diagnosis, very much not that so tedious compared to intestinal protozoa or the luminal protozoa. It can be diagnosed through serology. Yeah, I did one of my study in hospital Kajang, in 2015 or 14 something. Then I just do the serology. During that time, I did not utilize PCR. It was very expensive, but it is very much encouraged. If you want to do study, you have to do both, so that we can identify not only confirm the causative agent, but also some of those category, from the molecular point of view. It can be, being classified according to their genetic component. And then this is all those lists, how the diagnosis we made throughout the study. As I showed you, compared to Trichomonas vaginalis, we have only one, but then for toxoplasma, we have various study, not only among human, but also among veterinary animals, cattle, cats, rats. So it is quite wide. But then in terms of clinical manifestation, we do not have actually, because there is no large study that being done, to infer which one is much more important. In my opinion, looking at the trend, we have to identify which group. Which group. Then, if they have a risk, of course, the risk, the prevalence may be higher compared to those who are healthy. But in Toxoplasma, interestingly, I just want to share with you from the review paper, being done recently. We have, I just presented here the immunoglobulin M, means that the recent infection. The one with IgG, the old infection, difficult to interpret clinically because when we want to treat patients, usually we look for the IgM, IgM means that, and then if they have symptoms. So for the purpose of discussion, I just highlight here the findings for IgM, which include those IgM and IgG together. So here the range for pregnant ladies, the prevalence 1.8 to 2.7%, compared to this is patient with various disorders, means that they have underlying medical disorders. This is for migrant workers within, the not that very high, 3.8. And surprisingly, one of study being done in Pangku Island, I myself, I really, I'm not sure how to interpret this data because it is actually beyond my expectation. And if we look from statistic point of view, I would classify this as outlier. Perhaps they have to look into their mode of diagnosis, to confirm whether it is real, the prevalence 59.7. Perhaps it need to be confirmed with PCR and whatever. So I just reserve, even though the paper that describes, these findings, they say that very high, surprisingly high. But I don't think it is a true picture. It has to be interpreted carefully so that it will provide much useful information. And then we have among schizophrenic. Why schizophrenic? It has been found that a possible link between the abnormal behavior that being manifested by schizophrenic patients with Toxoplasma gondii infection. So they did some of the study, case control. One of the study, the below one, is actually my students. It was done in Hospital Kajang. And then the range for all those schizophrenic patient range from 1.1 to 3.9%. Okay, this is the trend. And if you look, based on the findings that I presented to all of you today, we realized that, as if, Toxoplasma gondii, being given special attention by most of our parasitologists. I think more on the reason for the logistics. Okay, this is the treatment. I just skip this one. Different compared to Entamib Studica, Giardalambia, and then the Trichomonas. We have different type of drugs here. Okay, we go to the final part, the final section where I say that I want to highlight on the opportunistic infection. When we talk about the intestinal protozoa, as well as the luminal protozoa and some of other tissue protozoa as well, it always linked with the opportunistic infection. And the one that I would like to highlight here is only the causative agent from luminal protozoa, as well as I add the Toxoplasma gondii. Opportunistic infection is an infection occur among all those immunocompromised individuals. So that one of the risks of getting intestinal luminal protozoa, it would be the group who are immunocompromised. And this is the definition of opportunistic infection. Parasitic infections are infections of parasite species, whether they have a mild or asymptomatic, or it may be fatal in immunocompromised. This is the characteristics. Opportunistic infection, for most of us who are immunocompetent, it has no issues. But then when they are having, some of those medical disorders, some of the risks to get some of the infection, usually they, in articles, they link with the HIV infection. But then I think it would be very much accurate if you link with the CD4 count. I think those who are in the laboratory do the ChemPath, you may be more familiar, with all this how it's being done. So opportunistic infection, in my opinion, would be much more appropriate when we talk from CD4 count point of view. So these are all those listed, the common parasites that may cause opportunistic infection. The one that I have explained just now, Toxoplasma gondii, Cryptosporidium falvum, for your information, it also can affect the immunocompetent. Yeah, some of those cases in US, if I'm not mistaken, you know, they have documented it properly, so that it also can happen among immunocompetent. And then Isospora belli. Isospora belli, the clinical manifestation similar like Gerdau. Yeah. And then we have Cyclospora, Microsporidium, and then I just put there mostly sejarah besi, as well as the Entamepa species. Yeah. This one from parasitic point of view, the virulent one would be the Entamepa histolytica. Yeah. So who are those who are immunocompromised? So I just put here as part of the sharing, you know, those who have a weakened immune system. And if you remember, during our COVID time, yeah, it's been associated with all those who have chronic disorders, yeah, diabetes, chronic kidney disease. But then from opportunity infection, usually they would link, you know, with some of those who are unable to fight, you know, with organisms, as well as perhaps they have coexisting with some of those chronic disease, yeah, malnutrition, and certain genetic disorders. And we have also to be considered, you know, those who are in a group that been given a prolonged steroids treatment, you know, autoimmune, as well as those who are on organ transplant, you know, or stem cells, you know, they also are, you know, in an immunocompromised group. So that, you know, we know that this is one of the risks that we have to consider if they present to us, you know, clinically, some of those potential diagnosis that to be included in one of the differential. And I also include here the reversible, you know, immunosuppress. I give example pregnancy, yeah, because high cortisol, usually those who are pregnant, you know, they tend to get certain infection, and as well as if you are stressed, stress also increase the cortisol. So that's why those who are sitting for the exam, yeah, thesis defense, they have a lot of mouth ulcer and whatever. So they also tends to have, but then not that as severe as those who are already the one that we described earlier. All right, these are all those that I mentioned here. When we talk about the opportunistic infection, it should be linked with the CD4 count. And then I found one of the articles that relate the number of CD4 count with the potential, you know, of the infection. And then they found that the classification as what I presented in this slide, you know, where large group of the protozoa or the parasites, you know, when the CD4 count less than 200 cells per cubic, yeah, millimeter. So because this is very important for us to provide, you know, some of those reserve on the potential infection that may occur, you know, according to the CD4 count. And for T. gondii, when the CD4 count, you know, less than 50. And in my opinion, because of we have a very much better care, you know, for our patients, particularly those who have been diagnosed with HIV. They have the PrEP, yeah, the treatment that being provided to them, and this usually being already been taken care. But then for us, there are certain groups, you know, that they do not know they are actually in immunocompromised. So these are the one that we have to consider. One of the differential will be the opportunistic infection, where it may be caused by one of the protozoa. So finally, I think what I can share with you today, just to provide, you know, some of the insight from medical parasitology point of view. What I can say when we look at the trend, you know, the clinical burden, you know, in my opinion, much less compared to other infectious agent. But then it should not be overlooked as if we can, you know, perceive the parasitic infection as negligible. I don't think that it is correct, you know, if we say that, oh, parasite dah tak ada dah di Malaysia. It's not. I think we have to some group, you know, still working on this one, because as I mentioned throughout the risk groups, you know, that may have all this kind of infection, parasitic infection still can exist, and it will, you know, related to all those high morbidity or mortality if not being taken care properly. And then from public health point of view, I think most of you realize that most of parasitic infections are not notifiable disease under CDC Act. Yeah, so it usually being done through symptoms, the syndromic surveillance. But some of those diagnoses were not established. But then we have some other diseases. Most of them are viral, bacterial, but not many from parasites. And then the clinical manifestation that I have shared earlier, it's usually been clustered with other underlying co-infection together. I give example like intestinal protozoa. Usually dia together dengan intestinal helminths. Di mana ada cacing, di situlah ada protozoa selalunya kan. So kalau tengok dalam paper pun kebanyakannya yang buat those STH dia akan buat sekali dengan entamoeba. But then papers yang buat entamoeba whatever semua dia jarang kadang-kadang link dengan cacing. Saya pun tak pasti kenapa. But in my experience lebih kepada scope of the research as well as the logistic. Therefore, strategies in diagnosis. I think most of you are dealing with all those executing some of those tasks, in the laboratory as well as management on how to support, laboratory as well as diagnostic systems, in any healthcare providers, so that what we have to strategize should be weighted based on the individual risk. Where does the individual coming from? Looking at the prevalence, I think we cannot do some of those conclusion. We cannot infer to the general population. And also during this time, I think it's very challenging where we have, remarkable shift in lifestyle, and then we have the emerging certain sexual behavior, they have, a lot of things, and then it being linked, with some of those infection, not only STI, but also some of the potential of the parasitic infection. But in my opinion, whatever the risk that they have, it should be utilized as part of approach to help us to solve the problems, not to be stigmatized, and then perhaps will allow some of those who deserve to be treated not having access to the treatment. And then I found that most of the findings being done by those who perhaps are not individuals who are working at the clinical setting, so that some of those their interpretation may be it would be correct, from a scientific point of view, how it has been classified, but from clinical point of view may not be significant, to be discussed in details. I give example like the one that, among healthy community when they found 59.7 have IgM on Toxoplasma gondii. I think if I have that data, I would redo again, because we have to confirm whether all those individuals need to be treated or not. So with that, I would like to thank for your attention. I give back, this presentation to Miss Sally. Yeah, Miss Sally.
Thank you, Prof, for your insightful presentation. I believe everyone enjoyed this, and what an open eye for us to get to know more about this parasitic infection that what we have in Malaysia. Now, I open the floor for Q&A session. If you have any, you may raise up your hand or you type your question in the chat box. At the moment, I don't see any question in the chat, but I received one, everybody see here, we received one comment or experience sharing from one of our microbiologists, Madam Masita. Perhaps I just read out and we may discuss in this details. So from her, she mentioned, I would like to share my experience. Protozoa detection in stool samples. This issue of integrity of samples, more than 4 hours of sample to reach lab is very difficult. Best to put stool in preservative, but issue of the costing. Usually only put in container without any preservative. So this is the challenge that we have in the clinical lab. Yeah. And another one is a staining with trichome, but with microscopists need to be experienced, competency of performing concentration, smearing, and staining various between MLTs, I mean the technician. Hence, not easy to detect protozoa. For Trichomonas vaginalis pula, not suitable container with preservative. So fresh sample not done immediately once arrived in the lab. So as not under urgent samples criteria requirement. So in her opinion, detection of protozoa in clinical samples in Malaysia is low due to these issues. So any comment from Prof?
Yeah, I'm not laboratory person, you know. I am more at the community level. But what I can suggest is that basically based on what most of you have experience, yeah. Why not, some of you, further study, instead of you are looking for the prevalence, but look for the much better equipment, logistics system, and what transport, the media transport, that you can offer in order to improve how you can maintain the freshness of the samples. And I found that for protozoa particularly, not much, improvement in terms of technology compared to, all those molecular. There are very many, whatever. But then in terms of the very gold standard diagnosis is still there. So that will be my opinion, my suggestion.
I see. As what you keep mentioning, it is being overlooked.
Yeah,
See?
overlooked. Yeah.
Yes.
And then I think, in my opinion, rather than you are looking for the prevalence, for the incidence, as I mentioned, we cannot infer to the general population. Why not you look into how to improve all those facilities in the laboratory when you are, further your study at master or PhD? I think that is very welcome. This is what we need,
Okay.
in parasitic.
Those who are
setting.
interested in this area, you
Yeah.
can look for Dr. Malina in UPM. Okay, we have one question from Muhammad Akmal bin Karim. Generally, how is the sensitivity and specificity of PCR tests for toxoplasma compared to serology testing? But Prof is not a lab person.
I myself, I'm not a laboratory person, but based on what I've read and the one or two study that I've done with PCR, you have almost 100%, the confirmatory, but it's just that whether it will be overdiagnosed because small portion of the genetic components, it can be amplified, and then you can, as if it is provide the positive findings. Unlike the serology very much depend on the antibody titer as well as how the individuals respond towards the infection. So basically, there are many factors that will contribute to the difference in serology. But then if you have PCR, and then right now, I think, unlike when I was, newly joined UPM, during that time, we have a machine, in two labs. There are many machines. And then it has to be function more than 24 hours for you to have the results. But now you can just run 1 to 2 hours. And then the gadget is only one, can be handheld only, very small. So a lot of improvement, for the technology. So that what I can comment regarding to PCR compared to all the serology.
Absolutely true. But somehow in a clinical lab that we have in government setting, serology is still widely made available compared to PCR. Even though right after COVID, we should moving more to PCR because the facility is
that's
made
why we need
available
people like you
elsewhere.
all to involve in politics so that you can suggest, Yeah, because our facilities, 30 to 50 years ago, similar.
Exactly,
And then
very true.
they are very, calculating of the cost lah when we try to suggest, or whatever. But we should be contemporary. If they can talk about AI, because AI, cannot be explored enough if it is not being done parallel to the existing technology during the time. You can imagine, kalau kita nak buat data analysis, big data analysis kat Malaysia, PCR tak banyak. Sebab dalam hospital, kita tak banyak buat PCR, tak ada lab. So, macam mana you nak buat some of the simulation dan sebagainya. So, ni agak kekangan lah.
Understand, very true. There's one question from Amira. She joined a bit later, but she would like to know more about strongyloides. It is not mentioned in the study with relation to CD4, but it is also noted as common opportunistic parasite infestation.
Ya, sayang. Sebab kita punya tajuk ni, kan ada pilih protozoa. Strongyloides tu cacing. I tunggulah Miss Sally jemput I lagi sekali ke. Vidu nanti
Can, you're most welcome.
kita cerita
We
pula
can
pasal
propose
cacing.
for another session.
Sebab nak cerita pasal semua cacing ni, I think kita kena buat satu hari seminar. So parasite. So kita nampak semua sekali. So only 1 hour, I think I have to select lah one of those issues that I think need to be highlighted.
Alright.
Okay, Amira, sorry Amira. Amira, kalau nak tahu datang jumpa saya lah kat UPM.
Wow, good. I think that's all from the floor. I don't see any question coming in. May I have one question to Prof?
Boleh.
Since you are a volunteer in providing the care to the refugee groups in Malaysia, right? You must have experience with them. So do you foresee any new or imported parasitic infection in next few years in Malaysia?
Basically based on what being done, so far, they have done some study on leishmaniasis. Leishmaniasis we did not cover for this. But I myself, I did not, I haven't yet. But then, interestingly, for the past 10 years, what we did find among all those refugees community, they are very, in such sangat tak berapa baik lah ya dia punya keadaan. Because kalau satu rumah tu you can imagine they shared with 4 families. Kalau rumah terrace 2 tingkat tu, satu bilik tu is one family and then ada mungkin family yang single, they all duduk dekat. Jadi kan bila very padat macam tu, tak cukup toilet dan sebagainya, when we do some of the screening, some of the babies yang datang tu, kita boleh nampak dia punya apa tu, I'll give example one of the cacing tu kita ada boleh tengok dia punya tu cacing kerawit, the Enterobius vermicularis, dekat dia punya tu. So tu antara yang ni lah. And then what we did is that study among refugees. That one Helminth lah. Tadi yang the first study I tak ingat nama siapa yang cerita tentang logistik kan. I think one of the sebab kenapa kita tak buat on protozoa study because of susah nak maintain dia punya
I see.
Samples. But then study yang kita buat dekat tu, dia punya prevalence on soil transmission was 30 to 45%. Untuk I punya study 37%. This was in Ampang.
I see.
In future, and then in my opinion, it will be maintained as such, the prevalence 30 to 45 or 30 to 50%, because they have no access to the healthcare system. They are on their own, and they have only NGOs came to them to provide some of the basic screening as well as some of the medications. And then there is no follow up. So that would be the situation. Itulah yang I boleh jawab lah related to
I see. I think it's good to publish all these powerful data to raise awareness to, government setting to do more things to prevent all the spreading to our normal community. All right. With that, thank you once again, Dr. Malina, for your time and expertise, and to all participants for your active engagement. Actually, today we have a record of dial-in as max as 142 participants today to join us. Yeah.
Thank you very much.
A good turn-up session. Once again, please do not forget to fill up the attendance list that Puan Mashida already posted in the chat. Okay. I think a take-home message from Dr. Malina today is parasitic infection is not common, but not to overlook. So with that, I end this session, and thank you for your time, and wishing everybody have a pleasant day ahead. Thank you so much.
Thank you very much, Ms. Ellie.
Thank you. Thank you, Prof.
Thank you. Okay, bye.